Good afternoon, everyone, and welcome to Grand Rounds. My name's Tom Fadden. I'm the chair and organiser of Grand Rounds, along with Leslie Crichton. This week, I'm very grateful for Claire Donaldson, who has stepped into the breach at very short notice to come today to speak. As part of her role as the president of the Society and College of Radiographers, and also a founding member of Equalite, we heard a little bit about Equalite last week from a previous speaker at the first of the talks for LGBTQAI Month. We were planning to have 2 talks, but this now we're going to have 3, so that's great. So thanks very much, Claire, for stepping in at such short notice. And we look forward to hearing your talk today about inclusive pregnancy status, guidelines, and example of a collaborative approach. And if you just say next slide, I shall endeavour to move slides on for you. If you have a question from the audience, please put it into the chat and we'll catch those questions at the end. Claire, thank you so much for coming.
Fab, thank you for inviting me. It's great to be here. Happy to go on to the next slide, Tom, that'd be grand. So, just thought I'd give everybody a little bit of a background on Irma. Obviously, as referrers, you will understand Irma, and this presentation was put together to be accessible for everybody, whether you understand Irma or not. So, medical examinations or treatments that use any form of ionising radiation are subject to the Ionising Radiation Medical Exposure Regulations 2017. These were most recently updated in 2017 and published on the 6th of February 2018. We need to ensure that there's no possibility of pregnancy prior to exposure, and there was a subtle word change that came into these regulations in 2018, and that moved pregnancy checking away from women of childbearing age to persons of childbearing capacity. Next slide, please. As soon as these came out, the Society of Radiographers, we're the professional body and trade union representing radiographers in the UK, and we have links nationally, internationally as well. When these changes came into Irma, we had members, correspondents asking for guidance and support in complying with these changes regarding pregnancy checking, which inspired our professional officers to look into how we support members to develop proper checking in their departments. Next slide, please. So the first bit of guidance that was created was the impact of Irma 2017, Irma Northern Ireland 2018 on pregnancy checking procedures. It was developed by 2 professional officers who both have a professional background in radiology and radiotherapy, as well as an interest in radiation protection. For context, this was 6 pages long. It was very peripheral. It talked about that changes should be made, but there was no real practical guidance for application of the new Irma regulations. Next slide, please. The same 2 officers attended the Transmasculine Pregnancy Conference that was held in Leeds in spring 2019 to present this 6-page guidance with the view of getting feedback from the attendees. The overwhelming feedback was that it was a good start, but it really required much more content for it to be effective. Next slide, please. So some people will be thinking, well, why does it matter? Because we know that approximately 500,000 to 600,000 people identify as transgender or non-binary in the UK. This is a best estimate based on 1%. However, upper estimates are around 4.5% of the population. It's estimated that 1.7% of people are born with variations in sex characteristics or intersex characteristics globally. We only know this globally because it's not recorded by the ONS at all. And some people with variations in sex characteristics and intersex people do have childbearing potential. Guidance published in 2020 by the Royal College of Radiographers, explains departments need to consider that trans male or non-binary individuals could have the capacity to become pregnant, and that some people born with intersex variations also have the potential to become pregnant, and that we need to be inclusive in our pregnancy inquiries to include these groups. We also have to now consider that an increasing number of trans men and non-binary individuals are choosing to become pregnant, and some have become pregnant accidentally because there is this mistaken idea that being on cross-sex hormones such as testosterone can stop pregnancy, which it doesn't in all cases. Next slide, please. One of the big drivers for the Society of Radiographers to develop this inclusive pregnancy status guidelines was the CQC Irma annual report of 2019-20, where it identified a notifiable incident that had occurred in Merseyside, where a trans male patient underwent a CT scan. There were no pre-checks done, even though it was part of the regulations to ensure that you establish a chance of pregnancy before the exposure, and it was found that that patient was pregnant. With the correct checks in place, it was an avoidable incident, and the recommendations from that report were that, you know, the employer develop patient information posters and share that learning with local LGBT groups to ensure that it was about developing good, trusting relationships between the healthcare provider and the minority group. Next slide, please. So what the SOR did next, there were 2 members who approached the SOR with some ideas about how to effectively address inclusive pregnancy status checking. And a working party was established with professional officers and members of the SOR. These 2 members that had come forward with their ideas, and also interested members from the SOR's Equalities Advisory Board. They had a few meetings. They developed a short life working group, and they realised quite quickly that they did not have the expertise required to effectively and sensitively deal with this change in how all radiographers were going to deal with this part of Irma checking. So they drafted in representatives from a trans cancer support and advocacy charity that's called Live Through This. They were invited to share their experiences of healthcare and input into the document. And they also then brought in the view on intersex and people with sex characteristic variations by including representatives from Intersex Equality Rights UK. Next slide, please. So this was really the kind of central tenet that they held when approaching writing this guidance. So transgender, non-binary and intersex variations, intersex and variation in sex characteristic inclusive practice begins with an active choice to change practice so that all are welcome and treated with dignity and compassion. Next slide, please. And the Society of Radiographers developed the inclusive pregnancy status guidance. For context, from the earlier guidance, that was 6 pages long. This new guidance is 60 pages long, so much more in depth, has some really excellent glossary of terms, glossary of common uses, brings in all of the equalities legislation, plus some practical advice, some reports on pilot studies that were conducted, one in a diagnostic department, one in a therapeutic department, and some really nice how-to instructional kind of information sections. At its most fundamental level, what the inclusive pregnancy status guidelines encourage departments to do is to change the pregnancy checking from what it is now, which within NHS Tayside, pregnancy checking is performed for everybody. So a patient will attend and through their name, how they present, and how what their gender or sex registered on our radiology information system. If they're between 12 and 55, when they present, then they will get checked. They will get asked if they're pregnant. Obviously, this is assuming gender. It assumes a lot of things, and it doesn't address that group of people, the transmasculine, non-binary, and people with a variation in sex characteristics. So what it's doing is changing that one question of is there a chance you could be pregnant to a two-part question. What you can see there on the slide is in the white box with the mustard top and bottom. That's the new form. It is it's got several more questions than two, but it's essentially a script to talk the radiographer and the patient through why they're all being asked this, not just anybody assumed to be female. But essentially, it takes it down to a two-part question for everyone aged between 12 and 55. The first essential question on that script is, what sex were you assigned at birth? Only if the answer is female, then they go on to say, is there a chance you could be pregnant? Next slide, please. So in anticipation of delivering these talks, I'd spoken to the professional officers who were involved in developing the guidance, because obviously we were looking at how it's being co-produced. And so her reflections were really that it's the most collaboration she's ever undertaken when producing guidance. And the following were her big takeaways: that in future she will welcome as many views as possible when gathering information for documents. She learned how to deal with a situation where the external contributors they sometimes had their own agenda that didn't necessarily align with what the working party was formed to do, but it didn't deter them to do, it didn't allow that to sidetrack them. They welcomed in the views, and they took the ones that brought the document together. And really the biggest one was look for the contributors who are involved or effective with the policy or guidance that's being produced. Next slide, please. So in NHS Tayside, I should have mentioned this inclusive pregnancy status guidance was published on the 1st of December last year. So we are now looking at how this is going to be applied to our radiation protection and pregnancy checking in Tayside. In order to develop it and to tweak it so that it applies to how we work in Tayside, we're running a pilot scheme in Angus Radiology, which started on the 1st of February and will run till the end of March. That is going to be applied to, so all patients for Angus Radiology, it's outpatients only. All patients are given an appointment. If they're given a long-term appointment, they're sent out a letter. The inclusive pregnancy status form and a piece of guidance information sent out with the patient's appointment letter, and they're asked to bring that in completed when they present at radiology, if they're between 12 and 55 and going to have their trunk irradiated. So in general radiography, that's chest, abdomen, pelvis, hips, spine, all CTs, and not for ionising radiation, but MRI, do pregnancy and breastfeeding check-in prior to gadolinium. So they're also being included. When they present to the department, the radiographer prior to the examination is just running through the form with them. In the last week, we've done this with approximately 70 patients across all 3 sites. So we feel like we're going to get a really good sample size in order to get good patient feedback as well. Before we started running the pilot, all the radiographers and all the team members that are working here in radiology were given the opportunity to give us feedback via an online questionnaire and raise their concerns, and their concerns were addressed individually, and the learning was shared amongst all the radiographers, admin staff and assistants before we got going. I think it's also worth pointing out that NHS Tayside currently has no specific policy or guidance for supporting trans employees or their managers, and this is needing to be developed, and we're hoping that by sharing the good practice of the Society of Radiographers in developing truly inclusive and representative policies and guidance, that NHS Tayside can kind of take this example as well. Next slide, please. So I just thought I would pop in a little slide specifically for referrers. So we, under the Irma regulations, making the inquiries about pregnancy or breast or chest feeding prior to exposure is the responsibility of the operator. However, as referrers, you're responsible for providing sufficient medical data to enable the justification of the exposure. This could be somebody's gender history. However, you have to be aware that sharing somebody's gender history can only be done when it's directly related to their care or treatment, and must be with the patient's consent, and can only be for that particular instance of care. So as a radiology department, we can't make a note of somebody's gender history as a reason not to, or to continue to do pregnancy checking in the future. It has to be each instance. There are many scenarios where an individual might not know or might not wish to disclose pregnancy, not just amongst the trans and intersex population. And so it's essential to provide everyone with as much information about the risk benefit of radiation dose before the procedure. And you have a responsibility to have these discussions with patients. We are currently making changes on the ICE referral system that highlights the need to have these risk benefit conversations about any examination that will irradiate the trunk. Next slide, please. I think that's just my references slide at the end. Yeah, so happy to share these slides with anybody, and happy to take any questions, and hope that it's a bit of a whistle stop tour through what is something quite large, but I think happy to take some questions.
Thanks very much indeed, Claire. Does anyone have questions or anything they'd like to comment about the talk today? Just looking for hands. There, you're getting some thumbs up and some. Oh, there is a couple of hands. Where's the hands? So I'll go to Sarah. Sarah Allstuff, who no stranger to Grand Rounds.
Hi, thank you very much for that, Claire. That was really excellent, exemplary work, and really grateful actually that you're doing this, and hopefully it's something that other services can take forward. So my question isn't actually about the trans inclusive language. necessarily, but I suppose I'm interested in the question that you ask, which is, I wrote it down, hang on. Is there any chance you might be pregnant? Whether that question, do you think, is sensitive enough to actually exclude pregnancy, maybe particularly in trans men who are amenorrheic on testosterone, don't believe their pregnancy risk, and may actually have some dysphoria around their risk of pregnancy. And so just wondering if that's a sensitive question. Also maybe for young people who may not tick that box, particularly if parents are looking over their shoulders. Wondering what you think about that.
Yeah, certainly on the information leaflet there is a section that talks specifically about testosterone and how it isn't an effective contraceptive. So that is addressed. I'm just looking at the form that I've got in front of me now to see. So which sex were you registered at birth is the first question, and then where's the pregnancy one on here? Sorry, it's a huge form. It's too big. The first set of feedback is that this is too big. We need to condense it down for Tayside. But yes, I think it is. So it's a script, but it's not a script, if you know what I mean. So radiographers will all have their own kind of particular style about asking the pregnancy question. Certainly for younger people, that is already an area of sensitivity that you need, and we do try and
asking about last period.
Take children under, yes. Essentially, my approach to it is have you started your periods? Because that usually, for most 12-year-olds, does take out the question anyway. But it can be a very sensitive thing, and yes, it is about learning sensitive language. What I would say is our guidance is really good or at the kind of language thing. It's a really good source of CPD. But yes, I agree. I think
it sounds like I was concerned that was the only screening question, but it sounds like you go into that in a bit more depth when you're assessing pregnancy risk, rather than asking patients for their subjective view when actually they may not have the understanding. So thanks for that. Yeah. Thank you.
Kevin McConville has a question or comment.
Thanks. Again, Claire, thanks for dipping in at last minute notice with it. It's really interesting to hear this. I just wondered, this is obviously pilot work that you're doing in Angus within it, but kind of two questions a minute. It sounds like, given the national guidance has just been out and just released, that Tayside is very much ahead of the curve, and in fact kind of being innovative in getting this going, and then if it works, this is something you can feed back to other NHS kind of trusts about how well it's working. It sounds like you're doing a good job with it, I think, from what you're saying, if it's pilot and being implemented. And I just wondered about a sense of, I see it in other forms that come through, insurance forms and things anyway, for patients from the GP population, but what has been the reception of the cis male presenting population in terms of being asked that question? Are they issues, or is it being received relatively well?
Yeah, so for our plan within Tayside is obviously to trial in Angus, make any tweaks we need to. There is, we don't do a great deal of paediatrics in Angus, so there may need to be further pilots on how that's dealt with probably paediatric colleagues to get their input on that. But yeah, we intend to share the findings through the Society of Radiographers. I'm using all my connections this year since I'm president, and going to get it into our professional magazine. I'm not sure if anybody else in Scotland is taking this, but there are, members in Scotland will be aware of it. So it'd be interesting to see what other people are doing. And the reaction of cis males was one of the concerns expressed prior to starting the pilot, both here and in the two pilots that are published in the guidance. Here in the last week, we've only had one cis male not have a problem with it, just write something on the form that was so the form asks, gives the opportunity to offer what are your pronouns, and in that section he just wrote, "I am a human." So it was obviously a comment on it, but it wasn't in any way delivered in any kind of aggressive or seen in any way as a refusal. And I think the statistics from the pilots that were run in Leeds and Liverpool were that there was a high, they were really quite worried about how cis male might take it. And I think about 89 to 90% of those who responded to the questionnaire were completely fine with it, had no problems completing it, and understood why it was necessary. So I do think that there is anxiety because of the idea of this kind of toxic masculinity reaction to it, but I don't actually think that's the truth in reality.
Sounds really encouraging. Thank you.
Thanks, Kevin and Claire, for that. I mean, your talk as a frequent requester of CT chests, because that's my job. It just listening to your talk, it just made me think very much about how it's a much more standard test now than it ever was. You know, it used to be secondary care only request, and you'd have to see someone in clinic and go through everything in great detail. And now primary care has access to CT chest, I think entirely appropriately. We're the only health board in Scotland that does that, but I think we're leading in that. There's a lot of requesting CTs before we see people in clinic because it speeds up the process and means that patients don't have to come back. So I think we're perhaps not quite so good at this. So hearing that the radiographers, this is absolute priority is really reassuring to me. In your experience, are there a lot of people who we've requested CT scans, we've said, yeah, not pregnant, on you go, and then when you meet them, actually there is a risk of pregnancy, you are doing pregnancy tests, you're cancelling or postponing the tests, and is that happening a lot?
I don't have exact statistics, and I haven't been working clinically for about 8 months. But when I was working clinically, it would happen. No, I wouldn't say a lot. I wouldn't say it would make a massive dent in things. But it is, as it's quite frustrating if you then have to get a pregnancy test on somebody. That we're encouraged to do more and more and more and fit as many patients into our lists as we can, and that can be quite disruptive. But obviously we're looking at from what's best for the patient and patient care side of things. So of course we would. But yeah, I don't have the statistics for that. I could share. I'm sure somebody would have them, but I don't think it's absolutely huge.
And I think even if it's zero, that doesn't change what you're doing here as being a really important thing for everybody, not somebody who would be is trans or is specifically we think is being missed. I think it's important for everybody, but it does just make me think that this is perhaps a little bit of work for us to do with primary care for referrals that come into us saying, should this person have a CT scan? Just get a little bit more information to say, and could they have a CT scan? And we've checked they are a cis female, then they're amenorrheic, then they're on the pill, they're not pregnant, whatever it is. So that's in the back of my head is just a little bit of extra work. Maybe we can do primary care.
Yeah.
Okay. Any other questions from our audience today? I'm just scrolling through and there's nothing just now. So I think you're let off the hook, Claire. So thank you very much.
Fantastic. Well, if anybody thinks of anything after the fact, they can email it to Equality, because that email's on those slides. So, and we'll do our best to answer.
Brilliant.
Thank you for inviting me as well.
No problem. Thanks very much indeed for coming. And it's always nice to hear an accent from home.
Yeah, back in God's own country.
God's own country, absolutely.
Thank you so much.
Next week at Grand Rounds, we have Cathy MacDonald, who is an expert in communication. And she was a hostage and crisis negotiator for Police Scotland, and now runs a communication skills consultation company out of Perth. She's going to come and talk to us about complaints, how to avoid them, how to manage them, how to deal with them, how can we get through the difficult complaint process. I think it's difficult for everybody. How can we help ourselves? How can we help the complainers and complainees? She's an excellent speaker, and I really recommend that you come along to that. I'll send out more information next week. Once again, thank you to Claire for stepping into the breach, and I will see you all next week.